Hello everyone, welcome to MedHeads. My name's Dr. Ferghal Armstrong, and today we have with us Elena Medo, who is the head of Leonie Health PBC, which is a company that specializes in breast milk and all things breast milk and is soon to launch. So welcome to the show, Elena.
Thank you.
My first question is, what's your view on infant formula?
Infant formula is definitely a food, and it definitely has the nutritional value that's required to grow a baby, but mothers have a better product.
Mothers have a better product. All right. So can you explain exactly why that is the case?
Well, infant formula is solely a nutrition product, whereas mother's milk has immune factors, hormones, really potent behavioral hormones that cause the
Mm-hmm.
baby to fall in love with his mother, which is
Yeah.
pretty neat. Um,
Yeah.
and about 100,000 different components that are bioactive that create a long-lasting, lifelong advantage to babies who receive it.
Yeah. Yeah. So I wanted to really focus in terms of the advantages of mum's breast milk. Let's focus on the neurodevelopmental benefits, the attachment benefits, and also the immune benefits. So let's talk firstly about the neurodevelopmental benefits. In what way do you think that mum's breast milk helps babies in the early stages of brain development?
Well, the emotional attachment is very important in brain development, and a very important hormone called oxytocin. We all have it, but breastfeeding mothers have a lot of it, and it is also in their milk. And it causes the baby to fall in love with his mother and vice versa. And when that happens, the mother's brain actually switches from a self protection mode to a baby protection mode. So, in other words, study after study, animal studies especially, have shown that the important behavioral aspect of self protection goes out the window if the mother is breastfeeding and her baby's threatened, and that's been shown with rats and rats that have a high level of breastfeeding hormones will actually jump in front of a flame in order to protect their baby. And so it
Yeah.
reverses the self-protection and it goes into
Mm.
a infant protection mode.
When you think about it, mother's love is the only reason why the human race still exists.
You're absolutely right.
It's absolutely crucial.
Yep.
Yeah.
And there's things that get in the way of and disrupt that hormonal
Mm.
chain of events. And looking to your career, it's especially important to note that things like cocaine and opiates actually disrupt that and
Yeah.
makes the mother
Yeah.
actually sometimes feel hostility to her baby.
Yeah.
And
Yeah. So, so focusing on the benefits, the what I would term the extra nutritional benefits of mother's breast milk. We've got, first of all, this attachment, and we understand now how it is absolutely crucial to survival. Let's talk about things like autism. What's your view on mum's breast milk and autism?
there seems to be some correlation, and there's emerging research to show that there are benefits of human milk with autistic kids. And a lot of that has been going toward that direction because of the dietary aspects of treating autism. And I think it's yet to be fully understood as to what the mechanism is, but there's definitely an association there with a reverse association that where the children with autism, it appears that the symptoms can be modulated with human milk or with other dietary interventions. It's not well understood what that is at that point, but I'm extremely curious on that as well.
So what you're saying is the jury's out, but there is an emerging signal that this could be something very important.
You're correct. Absolutely. The same
Mm.
as it is
Mm.
with, there's a dramatically less incidence of childhood diabetes. Also,
Mm.
for instance, even if they have the genetic profile to become diabetic, their parents were diabetic, whatever, it appears that having any non-human milk protein, such as cow milk protein, can cause that gene to express itself in babies who are not breastfed or who receive a few feedings of formula initially have as much as 25 times more incidence of juvenile diabetes.
Let's move on to the immune function of breast milk. So, I mean, when mums first of all give breast milk, they for the first couple of days, it's quite a clear fluid called colostrum, and that's full of antibodies. Tell us about colostrum and why that's so important.
Well, colostrum has a very condensed amount of immune factors. So there's
Mm.
about 6 of them that I call the rock stars of immunity. And
Oh, go on, tell us.
so my favorite one actually is secretory immunoglobulin A, if you would like to know
I've never heard of
specifically.
that. Do tell us what does that do?
Oh, that's amazing. That one, in combination with its little buddy lysosome, the lysosome, when the breast milk is in the gut and there's a pathogen that starts to try to penetrate the gut, the lysosome in human milk strips the protective shell off of the pathogen, and the secretory IgA kills it, destroys it before it can even get into the system. And because breastfed babies have about 16 times thicker lumen, it has the pathogens have to run kind of a torturous route to get into the baby's system. And so that's a protection as well. And then there's another component called mucin, which sounds exactly like what it is. It makes it all slippery, and the pathogens have a hard time getting in there. Now,
Yeah.
that's
So
oversimplified. There's about 6 other immune factors that I really like as well, but those are my favorite.
those are your favorites. Okay. Um, and of course, it's. I think it's important to emphasize that even though the colostrum doesn't look like standard breast milk, it's not creamy or white. It is full of value. It's full of nutritional value, full of immune value, as you've described. And contrary to certain cultural myths, it should not be discarded. It should be fed to baby as much as possible. Would you agree with that?
I would agree, and there are cultural myths that I think people or scientists now know what is at the root. It's always interesting to see what's at the root of cultural myths because there's usually
Right.
something there. And the
Right.
very first colostrum, oddly enough, in addition to the immune factors, it also has a mechanical function to make the baby how can you say, just poop the meconium out of the bowel. So the bowel, when the baby's development is full of this thick tarry stuff, and generally when they start breastfeeding, just a few drops of colostrum will clean that whole gut out and get all that meconium out of there.
So, Elena, explain to me why you think there are cultural practices whereby people do discard the colostrum.
Because it looks different, and our tendency toward, even in other cultures, whether it's goat's milk or cow's milk or sheep milk, whatever milk that the adults and children are drinking later in life,
Mm,
looks so
mm.
different than the colostrum.
Yeah,
And so
yeah.
it, especially in the Asian countries, they started thinking that it had a lot of impurities and poisons, is what they call it. The early milk has poisons, is what they say. And it is actually, the breast is a sort of a drainage system for anything that comes in through the lymph system, lymphatic system. It generally drains through the breast. So it may be true that there is an accelerated amount of those things. However, a lot of things in human milk, like high cholesterol, for instance, it's there for a reason because that actually trains the baby system on how to manage this interesting thing called high cholesterol.
So really, the take-home point for this point of the discussion is that do not discard colostrum. It's absolutely vital for babies' immunity, nutrition, and potentially survival.
Exactly. And it has about double
Yeah,
the immune factors. So if you
yeah,
think of that, then just half the
yeah,
amount is equal to regular breast
yeah.
milk. But in the neonatal
Right,
intensive
right.
care unit, they've done studies to show, especially in babies that are very premature, born at about 25 weeks gestation, and they immediately get put on a ventilator. And so they have a tube down their throat, and they have an NG tube through their nose directly to their stomach. So their mouth is completely being bypassed. So there's a really terrible colonies grow of pathogens in the mouth. So for years, they've done sterile water rinses of the mouth every 4 hours. And some great, brilliant nurses said, well, why don't we put some colostrum in there while we're cleaning the mouth? And so they've been doing that just intermittently at several hospitals for about 15 years. And even though the protocols, it's difficult to do because moms don't have a lot of colostrum. Some can't get any with the pump, but even sporadic use of it has decreased necrotizing enterocolitis and ventilator-associated pneumonia by over
Wow. Yeah.
50% in these babies.
That is amazing.
It really is.
Necrotizing enterocolitis and ventilator-associated pneumonia are very significant issues in the intensive care unit for babies.
And actually for
Yeah.
children too, because when children are in pediatric intensive care and they're on ventilators, they're very sick,
Yeah.
and they have a 50% fatality rate of ventilator-associated pneumonia.
Yeah.
So
Yeah. And all for the want of colostrum, potentially.
yes, exactly. And I was just talking to a neonatal nurse the other day, and she says, I just want to pull my hair out because she says there was a 23-week baby that desperately needed mama's colostrum. And so they spent a lot of time teaching her about it and this and that. And she came in empty-handed the fourth day, and they said, aren't you pumping? And she says, yeah, I'm pumping, but I haven't got very much, so I just threw it away.
Oh.
And the nurse literally, she says, I was losing it. She says, I try to stay patient, but she says, I wanted to say, how many times did I tell you how valuable colostrum is?
Yeah. Well, that's a useful segue into the difficulties that mums might experience in producing breast milk. So you've referred to factors that undermine human breast milk. How would you approach this subject?
Well, I'm going to be unpopular with certain parts of the population, but ill-informed doctors are present company
Oh, I accept
accepted
that. I
are
accept that. Yeah, yeah.
are absolutely to blame, because when you get a mom who wants to breastfeed, she's stated the intention to breastfeed, she's read books about breastfeeding. But then I just had a recent conversation with actually a close relative, and she called because she was failing at breastfeeding, and I do a lot of that coaching on the phone and so forth. And usually it's very simple corrections. Her doctor had told her not to breastfeed more often than every 4 hours and not longer than 10 minutes. So the baby was not gaining weight. So then the doctor says, well, if he hasn't gained weight by next week, I'm putting him on formula. And so, but of course, the baby wasn't getting enough. He was crying nonstop because he was hungry. She corrected those two things, duration and frequency. And all of a sudden, by I think it was 2 weeks later, her baby had doubled his birth weight, whereas 2 weeks before he had lost weight. And it's another thing that's really key, and I've been thinking about this a lot. Of course, there's a lot of respect for doctors, and no mother, at least most mothers, if they're healthy and drug-free, they want the best for their babies. But this mechanism that oxytocin, which is one of the breastfeeding hormones that causes the milk ejection reflex, and it's a very interesting hormone. It's actually one of my more favorite hormones as well. That switches it actually changes the mother's brain to be protective of the baby in place of self-protection. So when the doctor says, you're doing something wrong, what she hears is, I'm not protecting my baby. And then to make matters worse, the minute she gives formula, the baby stops crying, starts sleeping through the night. And the mother thinks, okay, I was harming my baby. Then the more potent thing happens. The mother becomes an ambassador for infant formula and how hard it is to breastfeed. So it's a
Yeah.
self-perpetuating thing. And I would think after
Mm.
all these years doing this, and the CEUs and CMEs, especially that doctors get, um, there's a big disconnect there.
There is. Let's just emphasize breast is best.
Absolutely. In most cases, of course, with drugs and things
Yeah.
like that, it's a hot mess.
Yeah. It is. Yeah. We'll come to that in a moment, I suppose. But there are other reasons why mums find it difficult to produce breast milk. Let's talk about some of the medical issues that mums may face.
There are deterrents, but not a whole lot of issues that actually prevent it. Obviously, a double mastectomy definitely stops breastfeeding or prevents
Yeah.
breastfeeding. Um, there used to be a big problem when a mom was taking psychiatric drugs. Some of those drugs, for instance, Abilify, which is quite effective for some women who have bipolar and psychotic kind of breakdowns and so forth. Abilify raises the prolactin level, which is the milk making hormone, but it raises it to so much higher than the normal rate that it acts to the opposite effect and makes them not be able to have milk. Also, there's always the fear of what comes through the milk and if it would be harmful to the baby. And thankfully, there's a great doctor in Utah that's promoted research on what actually does not just get into the breast milk, but sometimes the problem is that what gets into the breast milk might bind with something else in there and make it not be able to go back out through the circulatory system because it's too big to get through that junction. So there's things like that. If mom is terribly ill, so if she's lost a lot of blood during the delivery, let's say she's had a hemorrhage, and what carries the milk making hormone is the blood. The blood it's made in the hypothalamus of the
Yeah.
brain, goes into the blood system, and then when it reaches the milk making cells in the breast, it triggers them to start making milk. But if there's not enough
Yeah.
blood and the mom is so ill, she just won't make milk. But it's pretty extreme circumstances and actually very rare for a mom to have a
Yeah.
physical ailment that doesn't allow her to breastfeed.
I mean, I suppose let's touch on drugs. I mean, my understanding of substance use, active substance use disorders in mums is that I would recommend that mums breastfeed except during the times when they are actively using the substance. So if at that point I would recommend that mums discard that particular amount of breast milk for the time that the substances were injected, but other times I would still encourage mums to breastfeed. Is that consistent with your understanding, or do I have to change my
You
advice?
might have to change your advice. I'm sorry.
All right,
That is
tell me
it's
more.
absolutely true of marijuana. Of course the issues with marijuana are very understated, and there's a whole lot of things that moms are told because they don't want to deter the moms from breastfeeding because it is so good. But there's a tipping point. So for instance, with marijuana, um, it stays in the blood for 6 days to 6 weeks and gets into and
Yeah.
it actually accumulates and becomes concentrated 8 times higher than it's in the mom's bloodstream. And the problem with the studies that have been done, they have been almost universally underpowered, which is a great way to find no difference, as you know, in a medical study. But there has been a finding in a 2021 study that showed a 14.6 point decrease, a 14.6 decrease, percent decrease in motor development at 1 year in mothers who do routinely smoke pot. Now, even with that, for that particular drug, it's still better to breastfeed. But the behavioral problems with, let's say, cocaine and opiates are that this hostility to the baby, the bonding. It really interrupts that maternal instinct. And that's when you hear stories, the mom sold her baby for cocaine or whatever. And it
Yeah.
really
Yeah.
does cause harm. And I think another aspect, though, of that in almost every condition, because of the urge and the instinct to protect the baby, when that's blunted through the use of these drugs, then the baby is more likely to be either neglected, or the mother, we've all heard cases where the mother has allowed her spouse or a boyfriend to actually abuse the baby. She doesn't have those
Mm.
protective abilities. And so it's
Yeah.
really a multifaceted thing. I think what amplifies the problem is that a lot of moms become addicted before they get pregnant. And I've
Yeah.
I've talked to a really great doctor down in Florida at Children's Hospital, All Children's Hospital, and he did. I think he brought out the first program for uh, prenatal drug treatment because he did a survey and found that the majority of moms in the St. Petersburg area in Florida who were drug addicted and gave birth to drug addicted babies, regardless of what drug it was, they had sought help at least 4 times during their pregnancy, because they had heard
Mm.
also, which is true, that they can't just go cold turkey or the baby will die in utero.
Mm.
But if they seek
Yeah.
help,
Yeah.
they're scared to death of losing custody of that baby.
Yeah.
So it's a
Yeah.
it's a
Yeah.
complex thing, and I think people do judge those
Mm.
moms. I used to think,
Mm.
how on earth could a mother do that when she's pregnant? Well, if there's no help
Mm.
available and no guidance, but
Yeah.
breast milk has actually
Yeah.
proven to be, it's, all the details aren't in, we need a bigger study, but I sponsored a study with breast milk, with donor milk being given to neonatal abstinence syndrome babies, which is the new term for drug
Mm.
babies. Guess it's more polite.
Yeah. Yeah.
And
It's more
yeah,
polite.
the breast milk definitely mitigated the nausea, the convulsions, and the
Yeah.
vomiting that they would have. So I
Yeah.
think that, I'm not sure
Yeah.
what it
There's no
is.
doubt that breast milk helps,
It
Nas.
does.
Yeah.
Absolutely.
Yeah. So where do you come into all of this? You're obviously passionate about the
You think?
subject, but do you do anything else other than exude passion?
Oh, well, I try to. I
Tell me what you
well,
do.
I like to provide solutions for all these problems, and some are
Mm.
a little bit hard to solve, but others are, for instance, when the moms have the preterm baby and they need milk, and it's really a life and death thing. Then, when I came onto the scene, there were milk banks. There were a few milk banks. Most of them really didn't even do a blood test on the mom to make sure she didn't have an infectious disease that could be transmitted. And so there was a lot of reluctance by
Mm.
neonatologists to use that milk for many, many years. So my goal when I started my first human milk company in 1999, my goal was I talked to just dozens and dozens of doctors. And I said, what are you afraid of and how can we fix it? And so we created a safety protocol where the moms were blood tested for infectious diseases twice in the first 6 months. The milk, I developed a program where you can test the milk for drugs. In the U.S., you can't test the mom for drugs in order to give her milk, but you
Mm.
can test the milk for
Mm.
drugs to see if it's, and
Yeah.
the problem in the US is really that, let's say a mom is a drug addict and let's say she provides milk for her baby and the baby has a stroke and is damaged, 9 times out of 10 that mom or her family sues the hospital for a bad outcome.
Yeah.
So that's
Yeah.
difficult.
Yeah.
So my first big project in
Mm.
that was to create a commercially sterile, shelf-stable human milk with
Mm.
a lot of testing not only for drugs and alcohol, but also for adulteration. So some mothers, even in the
Mm.
NICU, they're ashamed if they don't make enough milk, and so they top it off with coconut milk or almond milk, or they hear that,
Mm.
oh, the closest
Mm.
thing to human milk is coconut milk, or and so they start adding that.
Mm.
So I developed a human milk analyzer, a mid-range infrared analyzer that could be used to take a look at what the major nutrients are, the protein, lactose, and fat, and to determine how much to fortify, because the preemies need more protein than full-term babies need, about 4 times more protein.
Yeah. Yeah.
And to also, it was a lucky break, but it would show a certain error message on the infrared analyzer if there was something in there that shouldn't be in there, like coconut milk, for instance. It wouldn't
Right.
it wouldn't read it correctly.
Right.
It wasn't approved for that purpose, but
Right.
it sure was handy. So I did that infrared
It sure
analyzer.
was handy.
And now my most recent project is to work on having a human milk product that never is exposed to heat. So the majority of the immune factors, like my favorite, which is secretory IgA, would not be destroyed or diminished because the baby needs all of that. So I have developed something that, other than the living cells, which you have to destroy, you can't be selective and say, oh, that's a good one, that's a bad one. You have to get rid of those. But other than that, it preserves the majority of the immune factors in human milk. And many of those immune factors have a catabolic effect on one another. So the sum of the parts, the effect is much greater than the sum of the parts.
So you've referred to the fact that you cannot heat milk. Can you freeze breast milk?
You can freeze it, but it does diminish the immune factors, not as much as pasteurization does, though. Pasteurization can wipe out as much as 80% of some of the most important immune factors.
So really, you need to maintain a warm chain, really, basically all the way through from production to use.
It has to be a cold chain, actually, not a frozen chain, but a cold chain.
Not a frozen chain.
Yeah,
All right,
because there are everyone thinks human milk is sterile when it comes out of the breast, and
it's not.
Now's my chance to say it's not sterile. But the big opportunity for contamination really comes after the milk leaves the breast and either is put into a bottle that has, let's say, Bacillus cereus, which is called the baby bottle germ. And those form biofilms that you cannot remove by washing it.
Yeah.
So those are just some of the challenges. I'm really proud of the current thing. I was hoping to retire someday, but maybe not. I'll just keep working at this. But I think that...
Not just yet.
Yeah, I do think that there's components in human milk that could cure cancer. It's already shown that there's less childhood cancer and leukemia in a big... several big studies that were put into a federal AOAC or a federal... it's a report that gives guidance, and it took thousands of studies on human milk and discarded the ones that weren't like top notch. And the results were that it not only is great for the baby, but it also reduces breast cancer in the mom, cervical cancer. So I've got to believe that there's really something in there. It's probably the immune factors that lead to better outcomes.
So we've spoken about mom, we've spoken about baby, we've spoken about breast milk. What about dad?
What about dad?
What can you do to help dads?
Oh, well, dads are way more involved than they think they are just by hanging out.
Well, let's hear about that.
Okay. So when dads cuddle with babies, they produce oxytocin, which the only other time a man produces oxytocin, if you'll excuse me, is when he gets an erection. After sex, he produces the other milk making hormone, which is prolactin, but that makes him go to sleep. So there's some really big behavioral stuff going on there. So cuddling, and especially in neonatal intensive care units, where sometimes parents really struggle with staying together when there's that kind of suboptimal outcome. And if they can get dad to come in and do what's called kangaroo care, where they put the baby on the dad's bare chest, and both the baby and the dad have an oxytocin rush, which again makes them fall in love. And then dad takes on those protective aspects behaviorally to protect his baby. So I think the most important thing dad can do, and after I breastfed 4 kids, I'm on authority on that personally, is when the baby wants to nurse at night, dad can get up, change the diaper, and deliver the baby to the mom in bed.
What's your view on pumping, and can dad use pumped breast milk.
Oh, absolutely.
Yeah,
They
if
can.
dad's doing the night shift, it's possible for dad to do the feed as well. Is that right?
The mom's milk supply is okay. Otherwise, the breastfeeding session at night results in more than a 40x increase in prolactin, which is the milk making hormone. So early on in the baby's life, it's probably not a good idea to skip nighttime feedings. But if once the breast milk is established and the nursing's established at about 2 months, then it doesn't hurt at all for dad to do that. And I actually developed about 6 different models of breast pumps. And I used ultrasound studies of nursing babies to create a funnel that would actually attach. It was made of silicone with different thicknesses, and it would actually suckle the breast. And lots of hospitals use that, especially because moms who have babies in the hospital tend to get discouraged. They may come in, they may say, "Oh, it's not looking good. Your baby may not make it," so they quit pumping. And so there's a lot of milk supply problems there. But this little thing with, again, mimicking nature by suckling, it actually produced, there was a study that showed it produced equivalent hormonal response as compared to the baby nursing. So, but dads are huge. I mean, they play a different role.
There's still a role for dad.
Oh yeah, I'm not crazy about the idea in the movie Parenting where they've got the the vest that has the fake breasts and the nipples coming out. It's kind of fun, but I think dads play a much more important role than that. They play a different role, and it's really a role of protection of their family. I know it sounds very old-fashioned, but biologically, that's what's happening.
So, Elena, sadly, we've run out of time,
gosh.
but I really do want to thank you. I really do want to thank you for your passion, your knowledge, and your expertise.
Thank you.
And I'm sure I speak on behalf of a lot of people out there to say that really you're changing lives.
Oh,
So thank you very much for joining us.
That really
today.
means a lot to me. Thank you. Good to meet you
Thank
too.
you.
Okay.
That's all for today, folks. My name's Dr. Ferghal Armstrong, and this has been MedHeads.